Let's see. Hillary. Yes.
That's okay. Thanks, Madison. And Linda.
Great to see all of you. Thanks so much for taking the time to join me and the rest of us this morning. So, Amy, I'm happy to introduce
Great.
myself.
Thank
So,
you.
I'm Laura Geyer. I'm from the University of Florida, where I work in the College of Medicine. I'm somebody who went to the University of Florida as an undergraduate student, and I never got out of town. So I work with the safety net meeting, working with a variety of different populations that are underserved. And I think I work with some of the best people in the world because we try to find creative solutions for populations to help them find access to health care. So some of the work that I'm going to talk about today is about patient activation. And I'm wondering how many of you have heard of this construct, patient activation? Anybody? So what I'm going to be talking about isn't theoretical, it's very practical, very applied work. And it's this construct, patient activation, fits hand in glove with health literacy. And it's a topic that I've been introducing in the medical school. Some of the medical students, I work with another physician. I'm not a physician. I'm a registered dietitian nutritionist. So we have a small group of medical students that we work with in a group. And so at the beginning of this year, we asked the students who work with patients to test their patients with patient activation. And then they work one-on-one with these patients over the course of the year to see how activated they can encourage their patients to be. And what I want to do is share with you at the end of my presentation some very exciting outcomes about activated patients, and one in particular, what she was able to do as she became activated through the one-on-one work with her medical student. So I'm going to go ahead and share my screen with you so that you can learn about patient activation. And let's see, let me share my screen first and then go ahead and share my PowerPoint presentation. I'm going to have to move you all to a place far away. And here we go. All right, let's see. These controls, I guess, are going to have to stay up there. So, patient activation. I know I can move. It's not letting me move that. All righty. So patient activation, and I'm going to ask you if this is a tool in your toolbox, and it sounds like this is a tool that's missing right now, but by the end of this presentation, I'm hoping to convince you that it's something easy that you can add. So let's go forward. So I'm going to define patient activation and help you see how it fits with health literacy. I'm going to introduce the patient activation measure, explain how you can integrate and use patient activation and health literacy tools to empower your patients, improve outcomes, and reduce costs of care. And I'm hoping by the end of this presentation also that you will have at least one idea of how you can take a concept related to patient activation and incorporate it into your daily practice. Now, here's one thing I want to invite all of you to do. Please, at any time, if you have a question, don't hesitate to either put it in the chat or go ahead and just interrupt or call out your question, because we have a small group. I do a lot of teaching and talking to groups of people, and I welcome your input throughout. Please don't feel like you have to sit on a question or a comment if you want to ask at the time, because sometimes that's a teachable moment. We don't want to let it pass. So what is patient activation? So this is a relatively new construct. It's only about 20 years old, and it describes the degree to which individuals have the knowledge, the skills, and the confidence So, real different. It's really looking at that attitude and that self efficacy or that confidence to manage your health and your health care and to share responsibility for managing your health and your health decisions with your providers. It's real different from health literacy because health literacy is describing the activities associated with finding, understanding, and using health information and services to improve your health and to navigate health organizations. So, when, as health providers and educators and clinicians, when we talk about health literacy, we haven't been explicitly talking about health self efficacy. And we haven't really been explicitly talking about shared decision making. We really have been focused on has been more the cognitive learning domain, finding and understanding and using health information and services. And more recently, we've been looking at communication best practices when we've been talking about universal precautions in health literacy and simplifying health information and using plain language guidelines and teach back to ensure comprehension of information. So, when we talk about patient activation, there are some assumptions that we're making and some questions that we want to ask. So, first of all, the research is showing us that activated patients manage their health and their health care more effectively than those who are passive. So, our questions then for today, and I'm going to show you not a lot of research and statistics, okay? And we learned from Dr. Zickman Fisher that numbers aren't necessarily better. But our questions for today: how can more patients become confident and informed managers of their health and their health care? And what knowledge, skills, and attitudes do they need to become activated? And you're going to find that really this is something very simple and easy to do. So, as we think about the patient and provider, or the patient and the educator dyad, we know that people who live with chronic disease face a number of very difficult and complex decisions every single day and all throughout the day. We know that more than one half of American adults live with at least one chronic health condition. And a number of them have to live with very complex treatment regimens. They have to monitor their health conditions. A number of people have to make lifestyle changes. They have to maybe follow dietary restrictions or medication management. Maybe they have to monitor their blood sugar. They have to count calories. They have to watch the amount of sodium or salt that they take in. They have to recognize when they need to involve a health professional with regard to their symptoms. And these two bar graphs show us the number of people with chronic medical conditions. And even though these data are old, we can see that they show a trend where the numbers are rising. We also can see that with regard to the types of chronic conditions that people are managing, that with regard to diabetes, we know that still about a quarter of the people in America who live with diabetes, that they haven't even been diagnosed. And the people with hypertension, that is still the leading chronic disease in America. Osteoarthritis is more women live with osteoarthritis, and there are more than 100 different kinds of arthritis that people live with here in the US. So, patient empowerment, both health literacy and patient activation, the goals of both of these constructs is to empower people so that they can manage their health. And patient empowerment, the goal is to help people so that both of these are elements of high quality patient care. When people are highly activated, they understand their role in the healthcare process, and they're able to partner effectively with their providers. Needless to say, patients should play a major role in being involved with their healthcare, partnering with their providers, and determining their need for care, and participating in the type of care that they get. And there's a growing awareness that patients should be more actively involved with and managing their care. If I were to ask each of you how involved you are with your healthcare, how would you describe your role? Nicole, how involved would you say that you are with your healthcare?
Well, my husband is a trauma surgeon and I'm a family nurse practitioner. So I would say I'm extremely involved in my healthcare, probably
Okay.
over involved. And I have 4 kids.
Oh, that's
So
wonderful.
yeah, so between pediatrician, family doctor, teen acne, you know, we're pretty activated in this house.
And so here's a question for you. How are you teaching your children to be active in their healthcare?
Well, here's a good example. So my son had a plantar wart that we were getting frozen off. He's 13 and he has a little bit
Okay.
of OCD, nothing diagnosed, but just, he's just very particular. And he noticed a lesion that looked like melanoma on his own,
Ah,
on his foot, because he was
that,
examining, looking for warts. Most 13-year-olds would not have caught that. And he brought it to
mhm,
me and his dad, and we both agreed, yeah, that needs to be biopsied. But he
yeah,
found that on his own on the bottom of his foot. So I think he learned to examine his feet just
right.
because of the wart. But I mean, that's an important thing. A lot of people die from melanoma because it'll be in their
Oh,
rectum or somewhere that they don't see it.
right.
Um,
That's a great example. Who
that
else
happened
wants to share?
recently. Yeah.
Yeah. Who else wants to share? How activated are you? How actively involved with managing your healthcare and participating in your healthcare would you say that you are?
Me or anyone else?
Anybody else? Anybody
Okay.
else?
I'll mute myself again.
Okay.
Hi, this is Meredith.
Okay.
I am a layperson in the clinical world, just working on the admin side. So I'll give you the other spectrum. Uh,
Okay.
I work with doctors every day, but don't have a primary care provider.
Okay.
Uh, and work actively to be empowered and act as an active patient on the preventive care side with diet and exercise. I'm diligent
Mhm.
about that. I'm diligent about teaching my children about that. And diligent about making sure my husband is doing the proper preventive care and due for his screening. So I scheduled his appointment for his colonoscopy. So similar to Nicole, I'm sort of the hub for
Yep.
questions about health and managing healthcare for our family and for myself and scheduling my appointments. But on the other spectrum, I am negligent about certain aspects of my healthcare management and not having a primary care physician, but all kinds of specialty care that I see and schedule.
So Meredith, you know what you are describing? You are describing a gatekeeper role. And at the risk of sounding sexist, what we find in the literature, and this is true in the research, we find that so oftentimes women find themselves in the role of gatekeeper for their family members, and we find that they are busy scheduling the appointments for all the family members, and often they are at the very bottom of the list in terms of managing care for themselves. Does that sound like a true picture for yourself in terms of the role in your family, and kind of is your managing your healthcare at the very bottom of your list?
I would say probably not for me, because I do know
Good,
it's important to lead by example. So
good.
I would say I make a point to say I'm ahead of it. Trying to, I make a point to say I'm seeing the doctor, I'm getting my mammogram,
Good, good,
I'm
good.
doing my screenings at the proper time and sharing that with my children.
Hmm.
But on the other spectrum, not having a primary care physician to do regular checkups and labs is setting a bad example.
Well, again, we're here to learn, and we can learn from each other as well. So again, patient activation, you know, we don't have to be perfect, but having that awareness and knowing this, how to be involved is what's key. So let's keep going. So I'm going to follow the example, okay, that Dr. Zickman Fisher gave when he was talking earlier today about, you know, being in the hospital and having lab values that he was looking at, having numbers that weren't interpreted for himself. So about 4 years ago, I had a situation where I had a small tumor on the side of my foot, and it grew not so big that I couldn't wear my shoe, but big enough where it was aggravating. And so I went to my physician. It was 2019. It was BC before COVID, and had an MRI and a biopsy. And in looking at the report that I got, activated patients are going to expect to be involved. And this was a portion of the report that I got back. And I want you to take a look at it, not that I'm going to read through it with you, but I want you to see the impression and the findings, and especially the last sentence here that I, CHB MD, personally reviewed the images and the report and concur with these findings. I looked at this report and see 4 or 5 years later, I'm starting to now get, my foot is warm and my foot is now bothering me. The tumor hasn't gotten any bigger, but I went back to this report to try to find something here to give me some explanation, because I knew that they didn't find anything, but you can see in the impression, the very last word there, squamous cell carcinoma. Well, that was certainly of concern, but I was told not to worry about anything. And you can see in the findings, there's really not a whole lot of information I can understand there. I'm an activated patient, but you can see that I have an MRI report here that I can't read and understand. And there was no attempt to give me a plain language summary. And so we have a system in place that is still not as open to the patient, and it doesn't involve the patient as much as could be. And so we have a way to go, and I consider myself to be part of that healthcare system because I'm a registered dietitian nutritionist and I'm teaching in the College of Medicine. And at the same time, I'm seeing reports that I can't read and understand. So we still have a ways to go to make the system more inclusive so that patients who want to be involved can be involved. So let's talk about the patient activation measure. So this is a tool. When it was originally designed, it was a 22 item, rigorously validated instrument. It assesses patient knowledge, patient skills, and confidence for self-management. There are 2 shorter versions, okay, of the original questionnaire with 13 and 10 items respectively. And I'm going to share with you in just a minute the shortened version that has 13 questions. When you score the instrument, the scores will range from 0 to 100 points. Participants are then sorted into 4 different levels of activation. The value for us as providers, clinicians, and educators is that once we know what our patients or our clients' activation level is, we can individualize a plan of care or education for them. Knowing a PAM score enables patient-centered care and interventions that build on knowledge, skills, and confidence. And in the past, I can't think of any tool or assessment that has ever been able to give me an estimate of my patient's measure of confidence. So the 4 stages of PAM in stage 1, which is the lowest level of activation, people who score in stage 1 are at the very bottom, and they are very dependent, believing that the nurse or the physician is going to fix them. Those who are in stage 2 or level 2 are going to understand that they need to be involved, but they're going to lack the knowledge and or confidence to self-manage their conditions. Moving to stage number 3, those who score in this level are going to have some sense of confidence to self-manage, but they're going to have still be somewhat dependent. They're going to be able to benefit from some small successes. So being able to create experiences for them to be successful, to build self-efficacy will help them to increase their activation. And then at stage 4, these are the patients who are going to be in that upper range, who are going to be reading on their own. They are going to have skills and are going to want to continue to develop more skills. They're going to be like the son who saw the spot and identified melanoma, not maybe by name, but said, hey, this is a spot that maybe we should be looking at, because he's aware that there's something here that is atypical, and he's moving forward because he has confidence in what he's looking at, and knows that there's something here that isn't what one would expect to see. So here's a sense of what the questions look like. And you can see this is the PAM 13, and I'll just move temporarily so you can see the patient activation measure. This is with the 13 questions, and you can see it's a Likert scale that we use with strongly disagree, disagree, agree, strongly agree, and then not applicable. And some questions may be in that category for certain individuals. You can see that there are 4 different, we sort into 4 different general categories. The first 2 questions assess the person's belief that an active role in participating in care is important. So the 2 questions, I'm the person who is responsible for taking charge of my health, and taking an active role in my healthcare is the most important thing that affects my health. And so a person will be, again, responding using the Likert scale. Now, the next 5 questions measures the degree of knowledge and confidence in taking action. I'm confident I can help prevent or reduce problems associated with my health. I know what each of my prescribed medications does. I'm confident that I can tell whether I need to go to the doctor or whether I can take care of a health problem myself. I'm confident I can tell a doctor or nurse concerns I have even when he or she does not ask. Confident I can carry out medical treatments I may need to do at home. I understand my health problems and what causes them. Next, 3 questions. Assess the ability to take action. I know what treatments are available for my health problem. I've been able to maintain lifestyle changes like healthy eating or exercising. I know how to prevent problems with my health. And then look at the last 2 and look what they're assessing. The ability to stay the course under stress. Because we know that life doesn't exist in the same place all the time, right? We go through bumps, we go through curves. And so being able to stay the course when life goes through those stressful times, I'm confident that I can work out solutions when new problems arise with my health, and that I can maintain lifestyle changes like healthy eating and exercise, even during times of stress. So again, one goes through the 13 questions and scores those questions, and we come out at level 1, 2, 3, or 4. And here's a little bit more expanded description of what those scores mean. At level 1, let's take a look at the description of what healthcare utilization might look like. When we're at level 1 and we're feeling very dependent and we are passive and lack confidence, again, healthcare utilization looks like we're maybe depending heavily on using the ED. We're having a more difficult time with preventive care and screenings. The ED is the place where we don't want to be going, certainly for preventive care or for routine care. At level 2, again, we're struggling knowing that we could be doing more for our health. Maybe we're intermittently using the ED. We have a high risk for readmission if we're admitted to the hospital. We're not using preventive care or screens regularly. With level 3, we are maybe intermittently part of our healthcare team. We may not have a medical home yet, but we're starting to become involved with preventive care and healthcare screenings. And once we reach level 4, again, we are becoming our own healthcare advocates, and we've adopted behaviors. And although we might be struggling, we're able to maintain the course during times of stress. We're able to maintain healthy lifestyles, and that's a key focus. There's a very low risk of hospital readmissions if we are admitted, and preventive care and screenings are routinely part of life. Now, when we take a look at the US adult population, the estimates of the percent of adults that fit into each of the levels, less than 10% are estimated to be at level 1. About 15% of US adults are estimated to be in level 2. When you add those two levels together, you get about 20% of US adults. And I found it interesting when I thought about the percent of US adults that also are at the lowest levels of literacy and that don't read well, because that's also about 1 in 5. The percent found in level 3, about 37%, and those that are most activated at level 4 at about 41%. For those of you who work with adults on a daily basis in a healthcare environment, I'm wondering what your thoughts are. If you think that that seems to be a pretty accurate reflection of the populations that you see. Do you think that about 20% of US adults seem to be in that kind of dependent and somewhat dependent mode?
I think
Level
it's
1 and
much
level 2.
higher in the population that I work in. I'm currently doing home health for the elderly, and I'm licensed in 5 states. And when I work in Nebraska or rural parts of Georgia, I would put them at 50% level 1. I mean, a lot of them don't even believe in going to a doctor. Jesus is going to heal them. And if their blood pressure is 200, that's the way their body was meant to be. I mean, they are so illiterate. And even trying to talk to them about screenings, well, the COVID vaccine's going to kill me. And I mean, this is very common. So I actually am surprised by this data. I wonder where they did this study. It was probably an educated populace, I would imagine.
Yeah. Yeah, this is one study. It was one of the few that I could find kind of an estimate of for the US population. I thought it was kind of low as well. Anybody else want to comment on these numbers?
Hi, this is Linda from New York, and I work with marginalized populations in the mobile healthcare field. And I agree with everything the other person just said. It's way higher than this. We have several problems. One is just their general overall literacy is low to start with, never mind health literacy. Their trust of the healthcare system is not good. And there's a lot of religious beliefs that, God will take care of them. So I think it's a lot higher than this.
Right. Yeah. My thought is also the same, that trying to, make a generalization about the population, about the activation levels, that these numbers didn't seem to ring true for me also. And my work in Gainesville, Florida, which is north central Florida. North central Florida is the only part of Florida that's called the Deep South. And despite the fact that Alachua County is where the University of Florida is housed, all of the counties around Alachua County have very low literacy, a lot of poverty. And in fact, once you get outside of Gainesville in Alachua County, we are surrounded by sister cities where literacy is lower, and we have very rural towns.
My husband and I are from Clay County, and we got our health care in Stark, and my mom lives in Gainesville, and I actually went to school in Gainesville, so I work in those counties.
Yeah. So Union County, which is in northern Florida, is ranked, like number 67 out of 67 by the Robert Wood Johnson Foundation in terms of county health rankings. So yeah, the good news is that in terms of activating our patients so that we can build their knowledge and their skills and their confidence, there are some deliberate steps that we can take to help them to engage more actively with us. And that's what we're going to take a look at in just a minute. So remembering that we just took a look at the questions that are part of the patient activation screen. So I wanted to just compare contrast briefly with questions that are often used as screens for health literacy, remembering that health literacy assessment still focuses heavily on literacy and reading skills. So the brief health literacy screen, which is also sometimes referred to as the CHEW assessment, and sometimes we see these types of questions used with BRFIS and with community health assessments, confidence with filling out medical forms, or questions related to asking people if they have trouble understanding their medical condition because of written information that they don't understand. So again, a very different kind of question. So seeing that if we ask questions that are associated with evaluating or assessing health literacy and add those to the kinds of questions that are associated with patient activation, we can get a better profile or a better understanding of some of the needs that our patients have. So the bottom line, and I don't know how many of you think about health and health literacy in these terms, but it's important for us to remember that health is an academic subject. And as such, it has to be taught to be understood. And health is not taught routinely or systematically in the US school system. We get snippets of information about health at different points. We learn about, health at puberty, and then we're told don't. We learn about health and substance abuse, tobacco and alcohol, in middle school, maybe in high school, and we're told don't, but we don't really get a sense of, the body and how the organ systems work together, and how to take care of our bodies. We often see statistics like approximately 80 million adults in the United States are estimated to have limited or low health literacy, but that's an incomplete statement, and therefore it's wrong, because what it's really trying to say is that they have limited or low health literacy in reading. So it's confusing because it doesn't complete the statement. So it's confusing literacy in reading with health literacy. Americans have to learn about health to develop proficient health literacy. And since health isn't taught in school, what we really need to be thinking is not that 80 million adults in the US have limited or low health literacy. What we need to be remembering is health isn't taught in school, and health is an academic subject. Therefore, Americans don't learn about health, and therefore Americans have low literacy in health or low health literacy. And 1 in 5 Americans have low literacy. They don't have good reading skills or good numeracy skills. So they have a double whammy when it comes to trying to help them understand their health. Going back to the points that Dr. Zickman Fisher talked about this morning. So higher activation levels are going to predict behavior. And we know that patients with low health literacy can be highly activated. So we don't have to have high health literacy to be highly activated, because we can be, again, interested in our health, and that's all that matters. Individuals with higher activation levels are more likely to engage in preventive care, so they are going to seek health screenings and immunizations. Higher activation levels are going to practice positive health behaviors. They are going to practice self-management behaviors, and they are going to seek health information. I thought this was a fascinating table because it's looking at the social determinants of health and access to the social determinants of health by activation level. And what it's trying to do is look at patient activation level to see how does it predictability to access resources after you control for differences in economic status, education, health status, and insurance status. So you can see that when we look at adults who have a regular source of care, an unmet medical need, delayed care, or who did not get prescription drug due to cost, this is what we find for all adults with a chronic condition. And when we look at those at the lowest level of activation, and then go all the way across to those who are the most highly activated, we can see that for every variable of those 4, adults with higher levels of activation experience fewer barriers, and they utilize more creative problem-solving solutions to access care. So for those, adults with a chronic condition who have a regular source of care, we see that more, who are highly activated than those at the lowest level, have a regular source of care. And we find that fewer of them didn't get their prescriptions filled than those, who had lower levels of activation. So again, being a more highly activated patient makes a difference. Are there any questions about this table or anything that I've said so far, or any comments that anyone wants to make?
I have a comment. So I have noticed that allowing patients to log into their own portal, I think, is probably activating so they can look at their own labs and things like that. On the cross side, though, I mean, my husband and I both practice medicine. The amount of questions we get now for every little lab, it's burning us out as clinicians. We have to spend 5 or 6 hours a day responding to patients' questions because they don't understand that a slightly lower sodium level is not a big deal. And so a way to kind of, I don't know the solution, but it's made our plates heavier, having patients be more activated in a way, because they don't understand what they're looking at. And unless they go to medical school, they never really will. It's too complicated. So I don't know the solution. Maybe you have an idea or you've heard this before. I don't know.
I certainly hear that from colleagues here as well. And again, hydration status, for example, that's going to can throw a major monkey wrench into your labs. and what you're saying is true, because people they can just nickel and dime you with their questions. You know, you can point people to general sources of reliable information, and that's some of what I'm going to be talking about here at the end in terms of how to activate your patients. It's also important to teach people how to come prepared to an office appointment, um, and to have a list of questions when they come. You hate to think you need to start penalizing people and limiting them to the number of emails or in the portal, how many questions they can send to you, you know, in between appointments. But I understand that some healthcare systems are starting to look at that and consider that there's going to be a charge if you go beyond X number of additional messages. Is anybody else, can anybody else respond to that? Those are some of the things that I know I've heard discussed.
Psychiatry does this. I have a friend who's a psychiatrist. So if you have an appointment with him, he charges
Yeah.
15-minute, whatever. If you go over that, it's like $20 a minute. He has an exorbitant fee. He's a
Yeah.
concierge guy, but that's what he's implemented, and people don't go over.
Right. Yeah, I think for the people who tend to maybe become abusive with questions in the electronic medical record, there's a limit with how many of those questions you can continue to send back between appointments, and beyond a certain number, you're going to get charged for an appointment. And I think that's probably what I've heard discussed most. I wish there were there's just not a one size fits all solution. So patient activation focuses on knowledge, skills, and confidence, and people with higher levels are going to have better outcomes. And the research shows that activated patients are going to be proactive, and they are going to engage in information seeking and preventive health screens. And once they develop knowledge, skills, and confidence, they're going to stick to it over the long haul, and they're going to be able to stick to it, to their behaviors under pressure, under fire, and no matter what's going on with life. This is a really interesting table that looks at, through a quality improvement lens, at 5 different areas of improving health literacy, improving clinical decision-making, improving self-care, patient safety, and improving access. And it's looking at knowledge, skills, and confidence, using a patient activation measure tool. And you can see that there are a number of individual interventions that are listed in each category. And again, the patient activation measure is able to identify and improve skills in a number of different areas. Patient activation measure, again, can be used as a tailoring tool, not only for looking at individuals, but also for evaluating your services, also for evaluating populations. So patients with long-term conditions, if you're trying to look at populations and the services that you're providing. So creating a patient activation plan. Would you like to have lower your rates of avoidable ED visits? Would you like to be able to create an activation plan that's going to help move patients from lower to higher levels of activation? So I'm going to give you 5 steps that you could consider using as a guide. And by creating an activation plan, the first starting point would be, of course, to administer the PAM to get a baseline activation level for each of your patients. You can review outcomes and engage each person in a conversation about their activation level. You could use motivational interviewing to discuss areas of change, find a starting point that they would be willing to use, what would be the easiest starting point, and each person is going to have, of course, a different place. The goal is for each person to become a proactive manager of their own health. And again, using health literacy tools like Ask Me 3 and Teach Back to improve communication and share the decision-making process would be ideal. Using digital outreach tools like the EMR to schedule appointments, again, to involve patients with managing their care, with scheduling appointments, scheduling lab work and tests, making them aware of when health screenings are due and appropriate, making them aware of immunization schedules for all members of the family by age, helping them to manage their education programs to build health literacy so that they can learn about different health conditions. How many of you who are clinicians have libraries for your patients so that they can either check out materials, or they can have access to videos or podcasts? Anybody? Do you point them to online materials that are reliable sources of information? How do you help your patients know what they can trust in terms of where to go for information?
I point them towards like the American Diabetes Association for their diets or things like that. I'll try to find a website, but there are a lot of people don't trust the CDC. They don't trust
Right.
the FDA. So if you try to point them, that way, they might be less likely to even go there. I think since COVID, there's just been so much political nonsense, unfortunately.
Yeah.
Um,
Do they trust university sites by any chance?
Um, I think those
.edu?
are less utilized because some sites they need a login and password and they might not be easy to navigate. They might have university lingo that's difficult. I think unless a person is university, in my opinion, they may be hesitant to go to a university site. They may feel like not confident.
Gotcha. I know like the University of Michigan, for example, has some really excellent patient education materials. So, I give people just general kind of rule of thumb. If it's a .gov or a .edu website, or if it's like American Heart Association or American Cancer Society, that those are reliable sources of information. So I just wondered what clinicians were using. Let's see. Health coaches. Are any of you using or working with health coaches? Or not using health coaches for specific reasons? I'm curious what's going on in the field.
What do you mean by health coach? Like a dietitian?
No, a health coach. So I know certainly in Gainesville, we went through a couple years ago, big push for health coaches. And we had a number of health professionals who were becoming health coaches. So what is a health coach? Well, it's undefined what a health coach is. But if you Google health coach, you're going to find that this is an emerging area of interest and practice. Health coaches support patients as they make decisions. They have a growing role as community-based patient advocates. And you can see that here's a model. You often find that they kind of play a role almost like a community health worker or a promotora, depending upon the role or the health coaching position that they hold. This is not a formalized profession yet. It is not a paraprofession yet, but it's something certainly to keep your eye on. I can tell you that at least in Gainesville, a number of nurses and therapists, occupational therapists, physical therapists, and others who and physicians who are looking for a change are moving into the coaching area. So again, something to keep your eye on, because this is not a profession, so it's not regulated, and because it's not regulated, and it's something for those of us who are regulated to keep an eye on. Digital communication, going back to the question of where are we pointing our patients and where are they going for information? We want them to become engaged and involved and activated, and we want them to know how to utilize healthcare. We want them to understand health information and build skills and become more confident. So I don't know if you are aware that the CDC honestly does have quite a bit of very reliable and excellent information, best practices, checklists about utilizing social media and other kinds of digital communications. I have utilized their best practices checklists for years for how to use media for communication with the general public, and have found that they err on the side of caution with how you communicate, and so therefore I have found them to be very helpful for myself. Um, Community toolkits for addressing health misinformation. I like to be able to teach the public so that they know how to recognize misinformation. Also, using health apps. So many people have health apps and they use them regularly. So again, I want them to know how to recognize a good health app. Text messages. Do you communicate using text messages? Do you have a health blog? Do you point people to videos or podcasts or newsletters? Great ways to activate your patients. And don't overlook the opportunity to use surveys as one more way to engage people and get their opinions, to find out what their experiences have been and to build confidence in them. Getting feedback and inviting people to share their opinions is one way to build confidence. And as you hear from them, it's one way for you to improve your services as well. When individuals have time to independently reflect on their healthcare experience and provide feedback, they do become more engaged and involved, and they know that you care. And that's really important and valuable. It's meaningful when providers have conversations with patients. It's an opportunity to provide instruction and education and information for skill building about how to navigate the system. You affirm people, and that builds their confidence. Oh, you made such a good decision when you did the following. And again, getting feedback from them. And I'm going to stop sharing because I want to be able to see all of you and hear what you're thinking and see if you have any questions. And I'm wondering what you're going to be able to take back and use. I hope there will be some things you'll be able to take back and use later today. We have all of 3 minutes left. And I thank you so much for participating and joining me today. Are there any questions?
Hi, Laura. Thank you so much for your presentation, and definitely a lot of great materials. I have a question. I do work with the geriatric population, and unfortunately, some of the ideas provided, like the digital things like that, is not something that would be applicable for them. Is there anything else that you would recommend?
If not the digital, I would go ahead with traditional media. I would go ahead with videos, with newsletters. I mean, we can still use traditional newsletters and newspapers and radio and videos that are podcasts. So those are traditional media, and I would think that an older audience would enjoy hearing videos and newsletters and things like that. Would that be something that you think your audience would enjoy?
Yeah, would you have any resources to any I know the CDC and have some, but if there's any to share or any that is
I
applicable for the senior population?
Yeah, I can tell you that the Florida Rural Health Association, we have been doing a series of health literacy webinars since 2021. And we have been taping them 10 a year since 2021. And they are all free and online on a variety of topics.
Okay, thank you. Is it Florida? What?
Florida Rural Health Association.
Thank you.
Sure. Anyone else? Well, it's 11:15, so for those of you who have to run to the next session or to the bathroom or to check your email, thanks so much, and I'll stick around for another minute if anybody else has a question.
Thank you so much. This was a great presentation.
Yeah,
Thank
thank you,
you.
Laura. Do you mind putting your email back up? I missed it.
I'll
I'd
be
love to
glad
reach
to.
out.
Sure, I'll
I'm
put it
based
in the
in
chat.
Jacksonville and would love to confer on our data.
Oh, great. I'll put it in the chat.
Thank you.
And also, we've been recording this presentation, so it will be available on the Florida Literacy Coalition website within the next few days.
Okay, great. Even better. Thanks, Amy.
Sure thing.